doesn't necessarily mean as far as there's not something down further down in there, but I didn't really see anything of the obvious. When I took her over to the carpet, it was, she had very difficult time as far as even standing, to be honest, and trying to get even her footing down. So I took her over to the carpet, tried to get her to stand, tried to get her to see her walking a little bit, and it was yeah. She definitely seems to, when I left her in there in the cage, notice that she does have like what we call a head turn a little bit, and with a slight head tilt. And I noticed that when she was out as well. So that's kind of something that's, again, more we see with something that's vestibular-wise. So to distinguish between the peripheral and the central, the thing that we look for is what's called nystagmus. Basically what nystagmus is kind of when your eyes kind of tick back and forth. There's different ways as far as how different directions that they go back and forth, and it then depends as far as whether that seems to be more central versus peripheral. So when they go this way, horizontal, it's usually less likely of central. When they go up and down, or say this is her eyes and they do this, then it's more central. It's even more central if it's very difficult for me to be, if I have to sit here and watch her, and it's very subtle if I have to, then it's more likely central, which is what was happening. I had to stare at her, and every so often I would see her eye go, and I had a colleague of mine take a look as well, and she agreed that it looks to be what we call rotary, a little bit more rotary, where her eyes just go like this, but it's very, very subtle, which means that it's more likely that it's central than it is peripheral, because if I have to work at it to really look at it to see as far as if she has the eye movement, then it's more likely as far as something central, which fits with her age and fits as far as with what you're telling me and how she's been acting. So as far as what we would recommend, I think it would be a waste of your money to keep her here for hospitalization, because the most that we would be doing for her here that you couldn't do at home is giving her what I mentioned to you before, the meclizine anti-motion sickness medication. If you're wanting to go for an MRI on Monday, I'd rather put all of your money into that than wasting your money here for hospitalization for the week, for today's Saturday, for the weekend. I think that would be a complete waste. If is she eating for you? Okay.
I didn't. You know what? Did you give her that treat? Did she take that treat?
Not really. No.
I was going to feed her dinner, and she probably would have eaten it, but I didn't feed her because I didn't know if you guys were going to have to put her out, so I didn't want to give her a meal.
No, just because of the fact that we don't have someone here to be able to do MRIs on the weekends, and she seems to be stable otherwise. Her heart rate's good. Her blood pressure is a little elevated. I think she's freaked out for being here, to be honest, and freaked out as far as what's going on, because they just don't understand, and they're taught the world is turned upside down, and they're just like, I don't know what's going on, and they get a little scared. Otherwise, though, her temperature is good. And I just did a quick little check to make sure that it wasn't not something neurologic, and more something because what I was told when I first saw her was that she just couldn't move. So there's multiple reasons why dogs can't move. If they're losing blood, they're not going to be in class, but she's fine. She's perfectly fine in that aspect. So I think it's something up in her head, to be honest, as far as what's going on with her. As far as that's concerned, it depends as far as the MRI, what would be the next best step. I can't say until you do the MRI. Exactly.
I would schedule it.
And I am working with Dr. Barone, who is the neurologist, on Monday. So I will be in personally. I'll inform her of everything that I have seen with her, or with Mercedes, what we have talked about. And she can take a look at Mercedes and go from there. Okay. Yeah. But I'll be with her as well on Monday, so she'll get the full scoop about Mercedes.
This medication is going to make her be able to walk. Like, we have 3 sets of steps. I mean, just to get outside their steps, which I have no problem. I'll help her do it. But
right. You can get like bath towels.
I have a sling for underneath her because we had the hip replacement.
Right. So you can use that. Use the front like a bath towel or another sling if you want to purchase another sling from us here. I don't know as far as I'd have to look to see. We use these things. It's called it's like a help me up. I don't know. If
I have one that's got handles. It's got the fleece underneath. Yeah. It was basically so that we can help her with her.
That'll be helpful for the back. Yeah. She's still on the front. She's not being able to do.
We got big towels we could use.
Okay,
that's
perfect.
Not a big deal.
So just keep an eye on things as far as her eating and her drinking. making sure that she should be able to go to the bathroom okay. Usually they don't have problems as far as that's concerned. If you want, you can keep her as close to the stairs as possible, or just keep pee pads underneath of her. If she wants to go out or whatnot, or she seems to struggle, you can have carpet runners for anywhere that you have.
That's the only reason we have carpets in the house.
Right. Okay.
So I should feed her. I should let her try to eat. Yep. Should I still keep giving her the Pro-In, or should I? Okay.
Yep.
Okay.
I would do everything normally, so they'll just ask you, since you'll most likely have an MRI on Monday, usually no food, no water,
the night before.
The night before, exactly. But I think as far as anything else, there's not too much. Like I said, I don't want us to be using, your money that you could put towards the MRI for hospitalization here when all we're going to give her is just the meclizine. So, okay. Yeah. So what I'll do is, let's see. Do you have an email address? I can email you the discharge instructions.
Yeah, Ashergirl, ASHERGIRL at AOL.com.
Okay. So that way you can go ahead and go home, and I'll prescribe you the meclizine for the time being, and then when you come back on Monday for the MRI, we'll take it from there, and then Dr. Barone, she'll take a look at Mercedes first, obviously, and then we can go take it from there.
Is this medication going to help her, you mean?
It's going to help her a lot. It's not going to improve a whole lot because we don't know what's going on up in here. I don't want to send her home with anything else because I don't want to screw up the MRI results. So I kind of wanted, the meclizine will be the main medication that won't affect the MRI results. Anything else could affect the MRI results, and I don't want us to have any false sense or false results or anything for the MRI.
Are we just wasting our time? Is she old?
Not necessarily. Okay, here's the scoop on this. So with Mercedes, if it is something as far as a tumor, most of the time as far as with tumors that are, potential tumors, if someone didn't want to do the MRI, we generally do is send them home with meclizine and prednisone or a steroid. Now, a steroid will not necessarily, it may reduce the tumor a little bit, but it will not completely get rid of it. Over a course of time, some dogs, they do well with it and they get better, but they will eventually at some point or another, it won't help anymore. Sometimes we do try to increase the steroids. She can't be on it for a long term just because of the fact that steroids can have other side effects to the liver and kidneys. But as far as in the long run, it won't be a cure for her.
What is the cure for the tumor?
You can do things as far as, depending on what the tumor is, you potentially could do something as far as radiation therapy might be an option. Surgery may be an option as well, but usually it's not really the greatest option for
an older dog.
Right. So you can try radiation therapy and see as far as if that could help to reduce the tumor. But again, that may not. I don't know.
And then you're putting the dog through unnecessary stress.
Right. So that's why, as far as usually with central disease, usually it's a tumor that's pressing, that's causing them to have the head tilt, them to not be able to walk well, and then being.
And that would just happen like that.
Yeah,
I mean, she was fine 10 minutes before.
Yeah, it's the thing is that it can. Yeah. I'm sorry. Yeah, usually that's what we run it flying on an MRI. And that's why, as far as there are people still want to know, and it's perfectly fine. We'll do whatever you want us to do.
Yeah, I'm just a type person. I don't want to. It can't be selfish for me to torture the dog.
Sure.
And that's my rule with my dogs.
Sure.
If it's time, it's time. I don't want you to tell me something that.
It's not curable. How about that? Yeah.
But we don't know yet until we do the MRI.
No, it's not curable.
Most likely, from what I'm seeing, it's most likely central disease. Most of the time, it's a tumor that's involved. Based on her age, based as far as what you're presenting to me, and based as far as what I'm seeing on my exam, most of the time it's a tumor. And that's what we find on an MRI most of the time.
You give us this stuff, she's not going to get better.
She'll get better, but she may get better, she may not, and if she does get better, she may go back to square one.
And I've been noticing in the past week or so that possibly she's been having a little bit of hearing loss. Like, I'll call her name and she won't even look over, and then look shocked when she sees me there. That's something that would be
Yeah,
I'm thinking that you get them, no MRI, you get the medication, the steroid or whatever, help her out for a
we
little
can do that
bit,
too. Yeah.
and then, you know, I mean, we're just torturing. You can't be selfish, or
I can, either way you go, I would support it. I understand either way. So.
I
Yeah.
promise my dog's no pain, so I can't.
Sure.
And I wish somebody could promise that to me in my life.
Of course, but yeah, that's unfortunately sometimes as far as with human medicine, that's not how it goes. But yeah, for veterinary medicine, that's our goal.